So thank you very much for asking me this really common question about should I have my bunion operated on if it's causing me no symptoms at all to prevent it from getting worse. And the first part of that question is, will my bunion get worse? And the answer to that is yes. So generally bunions do tend to progress with time, but the rate of progression is extremely variable between patients. So some patients progress within months, 6 months. Some patients take several years to progress. So there's an extremely variable rate of progression. And then the next part to that would be, is there anything you can do to prevent it from progressing? And there's very little that's been shown in evidence you can have in terms of splints and separators that might stop your bunion from progressing. The only thing that might help is if you've got a flat foot and that's causing your bunion, some insoles might help to prevent the bunion from progressing. So then you're faced with your bunion that's causing you no symptoms. So should you have it done to prevent it from progressing? So it may take several years for it to progress. So perhaps the answer to that is no. And also the surgery that you have, whichever technique you have to have it done, you will essentially take about 6 weeks in a flat shoe walking around. And then it will take another 6 weeks or so till you're walking completely comfortably. So you're talking approximately 12 weeks for a full recovery, which to someone who's having no symptoms at all is quite a lot. So what I tend to tell my patients is be very vigilant of the bunion that causes you no symptoms. Firstly, be vigilant for progression. So if it starts getting worse or causing you symptoms, then come back and at that point we can intervene. And the second thing, which is key, is that lots of patients have bunions for a very long time and it causes them no issues. They have a bit of pain in some shoes, but it doesn't cause them much in the way of issues. But then what happens is they start getting problems with their lesser toes. So what happens is their little toes start to claw up or start to move side to side, and that is very poorly tolerated. And the reason for that is that when you walk, you will tend to walk on your heel, your big toe and your little toe as a tripod of the foot. And if your big toe is not working very well, then it tends to put more pressure on your lesser toes, which ultimately are not designed for that, and they can start having problems. So the message is, if you have a bunion and you start developing any problems with your lesser toes, then at that point I would suggest coming for an opinion, as that shows that your foot is starting to what we call decompensate, and you might do well at that stage. So I hope that helps to answer the question about should you have your non-symptomatic bunion operated on, and my overall answer for you is probably not, but be very vigilant for an increase in symptoms or lesser toe pain. I hope that helps.